Good morning. Good morning. Thank you very much. For those of you who don't know me, my name is Steve Rosenberg, and I'm the president of COCHS, Community-Oriented Correctional Health Services. 5 years ago, in this very room, COCHS held a meeting on how the Affordable Care Act could change our criminal justice system by providing people with Medicaid coverage, and how, through the school-to-prison pipeline, racial disparities that create a two-track system in childhood, where folks are frequently determined whether they end up in the behavioral health system or the criminal justice system by the color of their skin. In subsequent years, we have held several follow-up meetings, including one in this room in partnership with the National Minority Equality Forum, who Gary Puckrain will be joining us shortly, on how health insurance coverage could cut down the disparities and create healthier individuals and healthier communities. In 2014, Congress passed the Excellence in Mental Health Act. When we at COCHS understood that the goal of this act was to create a new provider type that was premised on a trauma-informed recovery model that existed outside of the four walls of a traditional provider, we became extraordinarily excited about the possibilities of bringing that provider type to communities of color. In these communities of color, a disproportionate percentage of justice-involved populations live and work and play. This provider type is called the Certified Community Behavioral Health Center, a CCBHC. If you are unfamiliar with this, in your packet you have a description of the CCBHC program. In our work at COCHS, we spend far too much time traveling around our nation's jails and juvenile detention facilities where we see faces of young people whose skin is darker than mine, who do not have access to behavioral health treatment in the communities that they live. When we started understanding that CCBHCs could send a behavioral health team to a booking area of a jail to divert people, to a homeless shelter to connect people, to schools to assess people, to foster homes, to plan for release, so that a third of the folks who turn 18 do not end up homeless when released from foster care on a one-way track to criminal justice, we became incredibly excited about CCBHCs as a provider type. Created with unique bipartisan support, in partnership with the health coverage, this could impact the lives of millions of justice-involved individuals. We are extraordinarily pleased to be partnering with the National Council today to be here, and we are especially fortunate to have Senator Stabenow welcome you this morning on this timely occasion. We are delighted that Roy Austin, President Obama's Deputy Assistant for the Office of Urban Affairs, Justice, and Opportunity, will speak to us after lunch. The President's commitment to work with the bipartisan coalition in Congress to reduce the disparities in our criminal justice system is self-evident. But it is important for us to remember and understand that it is state bipartisan leaders like Governor Deal in Georgia and Governor Perry in Texas who gave us the data that demonstrated that treatment works, that it saves lives, it saves communities, and increases public safety. For those of us who are firmly committed to the vision of a more just America, providing access to behavioral health care that has no relationship to where you live or the color of your skin, we believe to be an important first step. CCBHCs represent a mechanism to understand that, to address the underlying issues of trauma and victimization that result in people being part of the justice system. When we implicitly devalue any American, we do not create a more just America. When we address a young white man who is addressed for possession of heroin and attending college by diverting him, but when we take that same young black man who dropped out of high school and is arrested with the same amount of heroin and criminalize him, we do not create a more just America. CCBHCs represent an opportunity to provide access to treatment for both of those young men, and we believe that that will be how we reform the criminal justice system. I want to thank the National Council for their all work to make this day possible. I want to especially thank Linda Rosenberg for her vision, Chuck Ngolia for his truly astounding skill and creativity, Jeannie Campbell and her staff for their intelligence and thoughtfulness. I want to thank my staff, Hannah Miller and Jesse Rothman, for their hard work in putting this day together. I want to thank my board at COCHS for their dedication. And finally, I want to thank Julia Lear, our founding board chair, and Nancy Barron from the Robert Wood Johnson Foundation, without whose support COCHS would not have started 10 years ago, and we'd not be in this room today. Linda, thank you very much.
Thanks, Steve. I'll get to thank you more fully a little later, but that was very eloquent. So I have a favorite quote from the poet Maya Angelou, who said, "I've learned that you shouldn't go through life with a catcher's mitt on both hands. You need to be able to throw something back." And this morning, I have the privilege of introducing someone who throws back with both hands. Senator Debbie Stabenow has been a champion for state-of-the-science mental health and addiction treatments in her home state of Michigan and throughout this country. As Congress's most effective advocate, we have watched her at work. We've watched her leadership, her tenacity, and her just plain hard work result in the passage of the Excellence Act, the most significant investment in behavioral health in 2 generations. Everything else we're busy debating most recently is really around the edges. This truly has the ability to be transformative. Additionally, that isn't enough, but Senator Stabenow is also a co-sponsor of the Mental Health First Aid Act, which will help first responders recognize the signs and symptoms of mental illnesses and addictions and make sure people get treatment rather than wind up in jails and prisons. So we owe Senator Stabenow a great debt of gratitude, and please help me warmly welcome her this morning. Thank you.